Welcome to Puro Politics, the political podcast of the San Antonio Express News. My name is Gilbert Garcia, and I'm joined by
City Hall reporter Joshua Fechter,
reporter Brian Chasnoff,
business editor and columnist Greg Jefferson.
And this is the 92nd episode of our podcast, and it's a special one. We're joined today by the mayor of San Antonio, Ron Nirenberg. Mayor, thank you so much for joining us.
Thank you for having me.
It goes without saying that the big story locally, nationally, internationally is the spread of the coronavirus, and I know this is something that's been occupying a tremendous amount of your time. And I wanted to I want to preface all our questions by pointing out that we're recording this on the morning of Monday, March 16th, and circumstances are changing rapidly with this story. And so for our listeners, just if you can keep that in mind. But I wanted to begin by talking about the fact that over the past couple of days, we've seen big cities, New York, Los Angeles, the state of Ohio, making the decision to basically shut everything down, shut down restaurants and bars. I think they're only going to have takeout and delivery service in those cities, movie theaters and so on, basically deciding we're shutting everything down except essential services. Are we headed for the same move here in San Antonio?
Well, certainly we're going to adhere to the CDC guidelines, and so today what you'll see is a limiting of public gatherings to 50. Mm-hmm. We were at 500 with a heavy recommendation to limit public gatherings to 250. With regard to social gathering spaces, places where people congregate, I think we do have to have those discussions. We're doing them right now. And we have to stay aggressive. I'm not ready to talk about any specifics right now because those discussions are ongoing. But again, we are going to stay ahead of this curve, and I think that's the way we ultimately delay and contain the virus the best we can, is that we don't lag behind the best recommendations and be over-prepared if necessary.
Right. And of course, as you said, there's still ongoing discussions here, but being that we are wanting to follow the CDC guidelines and limit ourselves to 50 or less. Obviously, in restaurants and a lot of the types of settings that we've discussed, I mean, you're going to have more than 50 people almost inevitably, I think. So how are you factoring that in?
And the CDC guidelines are also, obviously they defer a lot of the specifics to the local health authority, but the size of the space is a factor. In a room like this, for instance, you don't want to have 50 people in it. But we do have to get we do have to focus in on the fact that our key goal here is social distancing, and those cannot be, in certain circumstances, just suggestions. They've got to be mandates.
What is your general idea or suspicion of how widespread the virus is in San Antonio?
Yeah, I think we, based on what we're seeing happen on the coasts as well as in other cities, even in Texas, we can no longer assume that the virus is not present in our community. I think we would be blessed if that wasn't the case, but we have to maintain a posture as if it's already spreading in our community, with or without data to prove it. My assumption, and this is going by the data that we do have in other cities, is that we do have community spread happening in Texas. And so it originates in those communities through some kind of travel. And so we have to assume that there is some community spread going on. We don't have data to support it at this point, but again, our posture has to be that it is.
And what would you say to people, younger people who have the attitude that this doesn't affect me, I am impervious to this because of my age and because I'm healthy?
Yeah, it may very well be the case that you can, if you're young and have a good constitution and can get through illnesses, you'll be okay if you catch the virus. But the important thing to keep in mind is that you can also be a carrier and spread it. And it's particularly harmful for people with immune compromise. Pregnant women are especially vulnerable. Older residents are also vulnerable. And we don't know, the health professionals don't know exactly how well and how wide it spreads from person to person. So we have to do everything we can to be cautious. And that's why you're also seeing a limiting of social gatherings, regardless of whether or not they're high-risk populations. We have to ensure that we're not inadvertently putting others at risk.
Go ahead.
I was going to say, Mayor, about a week and a half ago, Austin announced that they were shutting down South by Southwest. At the time, it was kind of a shock to everyone. Now it's unimaginable that they would have done anything differently. Yeah. And last week, we had the announcement, last Friday, that the Fiesta is going to be postponed until November. And this was ultimately, I guess, a decision made by the Fiesta Commission, but I know you were very involved in that process. Was there a moment in this rapidly changing story when it occurred to you that this is just, we cannot have it at the scheduled time and in April?
It was moving in that direction and we could see it. And as the virus began to show evidence of community spread in other cities in Texas, we knew we had to accelerate the decision, in part because, number one, we don't want to be caught in a situation where there's large-scale public gatherings occurring, but also the fact that, from an economic standpoint, just common sense would dictate that people have to make decisions about whether or not they're going to move forward, and employees, service workers are going to be affected by those decisions, so let's give people enough time to prepare. So at the end of the day, it was, it was a relatively easy and unanimous decision to make, but I was a little caught by how quickly it moved from wait and see to we've got to go now.
Right. Now, and I think, the decision to postpone Fiesta made a world of sense, obviously, but it also, when you think about the public's reaction to it, it could feed into that sense of panic. Is there anything you can do to mitigate kind of that concern, the panic people felt after that announcement?
Yeah, I think we've turned the corner a little bit on that because, when this was an outbreak that was happening in China, a lot of the conversation was about how, we are not China. We don't see community spread. We didn't at the time have any community transmission at all. And we can take precautions to help life continue as normal. But as you started to see community spread on the coasts and more cases pop up in other parts of the city, people were starting to take this very seriously. And then about midweek last week, or maybe early in the week, we saw some pretty serious incidents and some really tough calls made, not the least of which is the complete shuttering of the NBA season. I think that the people really took note of that and understood that this is not a matter of if, but a matter of when, in terms of every city in the country having to get in full containment posture. And so that really was a watershed moment, I think, for the entire country in how we need to change our behaviors to ensure that this is an epidemic that we can see ourselves through as quickly as possible.
Well, you were talking about, with or without data, we know that this is present in our community. How many tests have been done by Metro Health? How are you sort of gathering that data?
I don't have the specific number, but I do know that tests are being done almost daily. And let me be clear, we don't know if there's community spread. We have to assume that there is. Okay. But the tests are being done. We are continuing to push to have a wider testing protocol so more people can get tested. The CDC protocol initially was very, very strict. And really hindered, in my view, a proper assessment of what community spread is, not just in San Antonio, but throughout the country. You're seeing the conversation quickly being pushed in that direction of, make more tests available, give us wider guidelines and protocols for allowing people to be tested so that we can get not just assumed proper posture, but also data to support it.
My understanding is that South Korea is testing absolutely everyone, even those without symptoms, and they're finding a lot of people who have the virus who have no symptoms, and that allows them to then quarantine. How close are we in the United States to getting to that point where we can, anyone who wants to be tested can be tested?
So we are, my understanding from the manufacturing chain and the initial moves of the federal government is that we're at least 6 weeks behind that. I cannot confirm that, but again, this is about manufacturing and supply chain, and it's about federal directive. Over the last several days, you've seen statements from the administration about really pushing tests out. We hope that continues. We are starting to get many more tests back. We have more testing capacity that we're going to be talking about later today with the governor. So that's moving in the right direction. We are testing folks again, regardless of their travel history, and those are all things that we have to continue to do.
What are the restrictions, though? Do you have to have had come into contact with someone who has the virus, or can anyone with these symptoms go in and get tested?
So at this point, it used to be that contact with somebody who has the virus as well as a travel history. And that's why it was super restrictive from the CDC in terms of testing protocol. But at this point, you have to have symptomatology, and you also have to have a doctor's order, basically. And that should include, basic information that the doctor would share with their patient about where they've been, who they come in contact with. But certainly, anyone who has had contact with a confirmed positive infection, we want to get that person tested.
That just strikes me as quite restrictive because,
Yeah.
someone who has a fever and a cough and is worried about this, they cannot just go to the mobile testing site and get tested now, right?
Not yet, but we're working to get that capacity as soon as possible.
Mayor, obviously San Antonio has taken on a heavy burden when it comes to dealing with evacuees here at Lackland, and including the people, passengers on a couple of cruise ships. Last week, the Washington Post had a story about the coronavirus, and you were quoted as saying that the federal response has been disconcerting, and that the lack of coordination at the highest levels of the Trump administration was simply stunning. If you could talk a little bit, I'm guessing that what you're referring to is just a lack of communication between the administration and your office and the city when it came to these kinds of taking on evacuees.
Yeah, well, and I think we've been having much more open communication and dialogue. I've been in meetings with folks now that show that they are more clearly listening to our local health authority. But it wasn't really lack of communication. It was lack of coordinated communication within their own vertical systems in the administration. We were having quite good coordination with CDC and HHS on the ground here in the evacuation mission and quarantines. And the disconnect was between the different layers within CDC, so much so that I'm not sure that what we were working with and the protocols that we were coordinating with the local CDC folks was actually being addressed in the administration. And at one point, when we had gotten sort of our hands around what's the best way to release folks from the quarantine, it was almost came as news to other members higher up in the administration in D.C.
I just think that a big reason why people are so terrified right now is because of the whiplash. Because a week ago, there were just the general impression was that this was sort of, there were clusters around the country, but in general you could move around. You didn't, people were looking at the numbers, but it turns out that this country had no idea what the scope actually was at that point. So where's the blame for that? I mean,
well, I mean, I'm not into the I'm not in a position to assign blame, but what I will say is that the messages from the administration, from the White House, have been entirely disconcerting with regard to how serious we should take this pandemic. A month ago, even we were talking about it potentially being a hoax and a plot, which is on its face ridiculous, but it gave people a sense of almost a cavalier sense of how we could deal with this, when all the health professionals were telling us that, like in any outbreak, we need to take this seriously and we need to take precautions, to the point now where you're hearing the CDC, as well as members of the administration talk about things such as lockdowns. We've gotten from there to here so quickly, it is disconcerting, which is why what we've tried to do in San Antonio is be transparent, be upfront with the information, help people make informed decisions, not take the lack of data for granted, try to stay in front of the information that we do have, while encouraging people to, in a cautious way, resume as much activity as is reasonable given the health guidance.
What kind of conversations are you having with the superintendents at the school districts? I mean, I know this is a big question mark for a lot of people. We both have kids in school right now, and obviously, the school has been shut down in San Antonio for this week, but we're in the various school districts. But we really don't know where we go from there. I mean, what are those conversations like?
Well, the conversations so far, obviously, the ISDs, are trying to keep coordinated and make the same decisions, and they're working with Marath and the TEA on those moves. They've been talking about remote learning, standing those capabilities up, as well as ensuring that some of these critically important services like free lunch and breakfast are able to continue. The conversations are mainly about getting the health guidance out, letting them know where we are in terms of community spread, potential community spread. Also, what we're hearing in terms of guidance from our local health authority. I think there's still a lot to know. One of the secondary impacts that our community needs to focus on, that we've been talking with hospitals about, is the fact that when you have kids stay at home and working families, that means the parents also have to stay home, and a large number of our medical system is made up of working moms and dads, and so we've got to focus in on those secondary impacts and provide some assistance if necessary to make sure that the hospital systems, for instance, can continue to stay 100% operational.
Now, it seems like, last week we heard of convention after convention being canceled. A lot of large events also canceled. It's inevitable that there are going to be job losses in the hospitality industry, just starting there. And as the economy, as it weakens, you're likely to see job losses elsewhere. Right. And over the weekend, we saw Congress pass kind of a package of relief, which for workers, which included paid sick leave. So, I mean, two questions. One is, does looking at this crisis unfold, does it change the way you think about paid sick leave and what the council did in adopting that ordinance?
No, I still think it was the right thing to do. From a fact that this is the most inequitably taxed state in the nation. The lack of access to health care and the cost that a family incurs for health care disproportionately affect the people who can least afford it. But in this case specifically, paid sick time would ensure that the person that's giving your food through the drive-through window is not infected, because they wouldn't have to go to work for fear of losing their job or losing their paycheck. So I think that this has really been an awakening, a reckoning across this country within business communities locally and nationally, that paid sick time is extremely important, and that's okay. I mean, I think that. We needed to have that reckoning, and I'm hopeful that maybe some things have changed in that regard.
And also, is there anything city government can do to kind of not necessarily mitigate the damage to the workforce, but to help workers either stay on the job or help those who are out of work?
Yeah, well, we're working to encourage paid sick time policies, also remote flex time and telecommuting as much as possible. We are working with local nonprofits to make sure there's availability for microloans and things like that for businesses that are suffering. Lift Fund, I know, is doing some work in this area, SBA loans as well. But we're going into a period where we're not only going to have to start containing. I mean, we're not only going to have to contain this virus, but we're also going to have to start anticipating a recovery and what that would look like for the most impacted workers and families. And let's be very clear. has been true, and even if we didn't talk about it, but natural disasters, emergency responses, climate issues all disproportionately fall on the most disadvantaged members of our community, and this is a clear illustration of that going on right now.
So you're talking directly with employers, or no?
Yeah, so we, throughout the last week and this week are talking with members of the business community about what we know, hearing from them what they see the impacts are, and also encouraging, mitigation strategies, particularly focused on those workers who are going to be impacted by the loss of work.
Mm-hmm.
Can you release any information about any contact tracing that Metro Health has done on the individuals who have tested positive?
Yeah, so those aren't complete, unfortunately, including the first travel-related case that I think it was Friday that we confirmed. That one's still ongoing. We have 2 additional contact tracing investigations that are going on with regard to the individual from Japan, as well as or who traveled from Japan, and then the person who traveled from Spain. Those are ongoing. We want to make that information as available as quickly as possible. But what a contact investigation includes is actually retracing the steps of the person, talking to anyone who they have come in contact with, and determining the risk of exposure. So in some cases, people will be put into isolation observation if there is an elevated risk. I do know that based on a report I did see that there was a school on the north side who was impacted, or that was impacted because the child of the person, I think, was in that school. That school has already been notified, and they're taking the precautions. I think they've already done all their scrub down and everything with the school not open last week. So all of that is ongoing right now. And as you would imagine, contract tracing investigation are really the long-hour work, a lot of manpower involved in that, and it takes some time to do it right.
Mayor, obviously, all other issues right now pale in importance to the coronavirus and what we're dealing with that. But I wanted to ask you about this because I think this is another big question mark that we're dealing with circumstances that we haven't encountered before. And in roughly 6 weeks, we've got an election over whether to renew PreK for SA, a program that I know means a lot to you, and I think by all accounts has been very successful in San Antonio. And I was just curious how you approach that. I know under normal circumstances you would want to be out there campaigning and really encouraging people to vote for it. How do you approach something like that now?
That's a great question, Gilbert. It's going to be difficult because the guidance from the CDC again on the public gatherings is 2 months, and 2 months from now we're going to be in the middle of June. It'll be past the election. So, if we're being realistic, during the time of early voting in this election, people are going to be, really kind of in the height of our containment efforts. And so, I was just talking about it this morning. What we have to do is make sure that we're using every opportunity to communicate beyond in person, so online, mail, phone calling, relying on just neighbor-to-neighbor communication to make sure that, number one, people are aware that there's an election. We have to also work with Bexar County to make sure that elections are done in a way that people feel safe about them. This is a little bit of uncharted territory, but I can tell you that it doesn't take away from the importance of PreK, early childhood education, and the investments we're making in our young people. There is a day after tomorrow. We are going to make this through. We are going to make it through this issue. And when we do, we hope that we're stronger for it. And it will be because we stay focused on those issues that I think we're beginning to move the needle on. Investments in our children, a wider access to economic opportunity through the educational pipeline, including post-secondary education, investments in ensuring a stream of affordable housing, and of course transportation. These are all priorities that need to continue to move forward even while we deal with this very difficult situation.
And speaking of transportation, what is your guidance on public transit right now?
Great question. Right now, they are taking their cleaning protocols and stepping those up. I think they're doing multiple cleanings per day. They're encouraging distance between passengers. But VIA has been in those meetings with folks from Metro Health to ensure that they're keeping up to the guidance.
So you anticipate that VIA will continue their bus service, and that won't change?
At this point, yes. But again, we're going to continue to work with our health authority to make sure that we're at the front end of the guidance on public transportation.
I was shocked to see yesterday that the governor of California advised anyone over 65 to not leave their homes.
Yeah.
I guess two questions. Do you think that was a good idea? Would you advise residents here of that? And also, do you think that the Texas governor is in line to make similar recommendations and guidance?
Well, I'm scheduled to meet with Governor Abbott today, so we'll talk a little bit about that. But bear in mind, different locations are in different places on the curve, and we're talking about flattening the curve. Obviously, China was in a different place than we were, and even places on the coast are in different places than we are. Of course, we can't assume that ours is too terribly different than even the West Coast because we've got travel going on. But what we want to do is delay, prevent, delay, and contain, flatten the curve. With regard to encouraging older residents from leaving their homes, what we are doing right now is encouraging older residents not to go into public gatherings, not go to places where people are congregating, because we know that older residents, older people are more susceptible to more intense symptoms and higher morbidity with this virus. So they are most at risk in terms of if they catch the virus. We aren't yet at a place where we're telling them not to leave their homes, but at the very least take precautions. And for those people who come in high contact with individuals, older citizens, we want to make sure that they're also taking precautions because, again, maybe you're not part of the high-risk group, but you can carry it and make someone sick, whether it's your own grandmother or someone who then passes it on to another person.
Go ahead. How likely is it that the city will mandate restaurants and bars to be closed in the next few weeks?
Yeah. So again, we're at the point right now where we're going with the CDC guidance in terms of public gatherings. We are having ongoing discussions right now. In fact, I have meetings today with members of the restaurant community, and we're going to stay in front of this. We're going to stay aggressive. It's too early to say where those restrictions might end up, but again, what we want to do is make sure that we're over-prepared, not under-prepared.
Well, I think on that note, we're going to wrap things up. And Mayor Nirenberg, can't imagine how busy you are at this moment, and we really do appreciate you taking time out and helping to inform the community about what's going on with this. And for all those listening in, we'll be back next week. We appreciate you listening, and take care, and please stay safe.